President Cyril Ramaphosa has moved the country to adjusted level 3 of the national lockdown, with restrictions on the sale of alcohol, leisure traveling and public gatherings being relaxed. Now, the announcement follows his meeting with the National Coronavirus Command Council, the Presidential Coordinating Committee and Cabinet. Ramaphosa said the decision to relax restrictions was based on indications that the country has passed the peak of the third wave, with the number of new infections steadily dropping. Now, let's discuss this further. We're joined via Zoom by epidemiologist from Stellenbosch University, Dr. Joe Barnes. Dr. Barnes, thank you so much for your time this afternoon. Now, was this the right move, considering that infections are rising in other provinces? And while figures show that we've largely passed the peak of the third wave, some areas are not showing a decline in numbers. So was this a right move to adjust back to level 3?
I'm very glad I'm not in President Ramaphosa's shoes, because I think he has an extremely difficult job at the moment. And you would have noticed that the latest easing is very cautious. There is officially, we have 150,000 active cases. But remember, that depends on how many people got tested. A number of people will have also had the disease, but without any ability to show any symptoms. So that 150,000 is actually a lot more people than the figures show. So I'm very glad that the opening was cautious. I can't, as a person outside the MAC, tell you why they have these curfews still, and what a difference a curfew between 9 o'clock and 10 o'clock in the evening actually makes. I have no idea what they base that on. But I am still concerned that people think that because the numbers are dropping, that the crisis is now over the worst and will be going away. Nothing is further from the truth.
Now, Dr. Barnes, I'm hearing some level of concern from you, as are many people in this country, particularly because, we were told that come October, we might be very likely looking at a fourth wave. What are the numbers telling you, and what should those that we look up to really be doing in terms of curbing these numbers?
You're quite right. I am concerned. And I'm really worried about, the looting and the violence. I don't know if you've looked at so many of these videos, but just about nobody had a mask on. And you will see a peak of those cases that were caused by that behavior, probably only in 40 days' time, or some time lag like that. So we don't actually know whether this temporary reduction in the numbers will actually rise again. I'm pretty confident that we will see another peak sometime. We have not got this under control. And our best and desperate hope is vaccination as fast as possible. So, and of course, cautious behavior. And the violence that we saw was anything but cautious. So I am concerned that we are not going to beat the enemy, the virus, the way we are doing at the moment. But there's heartening signs that we've been getting a lot more vaccines, and that helps a lot.
In fact, I was going to then go into that conversation with you in terms of the vaccines. We know that in about 2 to 3 months' time, South Africa will receive about 31 million vaccines, Pfizer and J&J batch. Surely then, Prof, taking into consideration just some of your concerns and also, what we have been seeing over the past week in terms of the unrest and what the potential of that could be come October with, the talks of this fourth wave. Surely these numbers of the increase in vaccination will somehow counter what we're likely to expect in October? And I know that the other problem, of course, in this country is there is some sort of vaccine hesitancy or skepticism that we are seeing in some provinces.
Vaccine hesitancy is understandable in anxious times, and we need a lot more attention to people who are fearful of getting it. That's a very big difference between a person who's vaccine hesitant and an anti-vaxxer. And there's no arguing with people who are anti-vaxxers. And the only thing that one can hope for is that eventually they will see the light of day. We need to concentrate on people who are, for various reasons, fearful. Some of them are afraid of needles. Others are simply fearful of letting something in their body because they heard all these stories. We need to concentrate on them. That usually abates when a lot of people have been vaccinated, and apart from a few rumors, nobody's actually seen any bad reactions. Then the vaccine hesitancy tends to die down. So our best bet is to vaccinate anybody and everybody who's willing, and that'll help us abate that. But some helpful encouragement from church leaders, from community leaders, from political leaders would really help, instead of the political bickering that we are seeing at the moment across the spectrum, not only in health. It would really, really help if we could pull together and show our people that the way out is to get vaccinated.
Dr. Barnes, there is some hope that come the 22nd or at least February 2022, at least 40 million South Africans would have been vaccinated. What would this mean then for the country and its treatment and its management of this pandemic?
That would be the closest we would ever get to getting back to normal, to getting back to the life we used to know. And we need to keep that up, because in the last few weeks, every single person in America who died from COVID was unvaccinated. And nobody who died from COVID, no vaccinated person died from COVID. And I can't get a better demonstration of what would help us than that. So that's our ideal that we need to strive for, and the best possible route out of this problem for us, so that we can pick up the pieces, get our economy going, and get our people with more hope for the future, is to vaccinate.
And just talking about those stats that you've just bringing to the fray, Dr. Barnes, I mean, a lot of people saying that it is my right not to vaccinate, and some saying, well, if you don't vaccinate, the chances of another variant increasing are very high and very possible. Is that a reality for South Africa?
Unfortunately, if we have a large number of people vaccinated and only a few refuse to be vaccinated, then those who went for the vaccine are actually protecting the people who refused. But if the number of people who refuse are very large, then they constitute a danger to everybody, because they are the carriers of the virus. And the new Delta variant, as recently work has just come out, is about 1,000 times more infectious than the old one that we had in the beginning of 2020. So we're dealing with an enemy that is very wily and can change its outer coat and become more dangerous. We really, really need the vast majority of our nation to be vaccinated for us to get through this bad period.
Dr. Barnes, thank you so much for your time this afternoon. That was epidemiologist from Stellenbosch University, Dr. Jo Barnes. Not entirely convinced that we should have moved to adjusted level 3. She's obviously saying that everybody needs to vaccinate as soon as possible so that we can prevent seeing another wave, which has been predicted by scientists now to hit us probably around October. Also saying there that the unrest that we saw in KwaZulu-Natal and Gauteng, some of those scenes that we saw could lead to that fourth wave coming a lot sooner.